This video will review the instructions for pets that have undergone the tibial plateau leveling osteotomy procedure, or TPLO. The information covered in this video is the same information the discharge nurse will review with you during your discharge appointment. You are welcome to keep your discharge appointment after watching this video, but you may also skip the in-person discharge session if you do not have any questions. During your discharge appointment, you will receive printed instructions on caring for your pet after surgery. At the top of the discharges, you will find your pet's diagnosis and any implants that were used in surgery. The care instructions will include initial recovery from surgery, instructions for medications, feeding and water instructions for your pet, bowel habits after surgery, cryotherapy and caring for the incision, including e-collar use, and we will review the typical future appointments after surgery. It's important to keep in mind that your pet has undergone a major surgery. Not all pets act the same after surgery and anesthesia, but it is important to remember that they still need time to heal. There can be a significant amount of pain associated with the surgery in the first 3 to 5 days. It's best to give pain medications regularly during this period. Until your pet is no longer showing signs of pain, be cautious with any children or other dogs that have access to them during the recovery. If vomiting, nausea, difficulty breathing, or lethargy not related to medications develops in the first 3 days, contact us immediately or seek medical attention at your nearest ER clinic. Medications prescribed for your pet's recovery will be listed on the discharge instructions under the medication section. Each bottle is labeled with the name of the medication and the directions. Please ensure you have all medications that appear on the list before leaving the clinic. Some medications are refrigerated and may not be prepared until you arrive. The timing of the next dose will be listed under each medication and will be highlighted. If we recommend discontinuing one of your pet's current medications, we will include that recommendation in the medication list. If your pet is on medications that are not in the list, please ask your primary veterinarian if you need to continue them. Your pet can resume their regular diet when they are back home, but it may take several days for their normal appetite to return. General anesthesia can cause nausea that may last for 24 to 48 hours. You can offer more enticing foods for the first 2 to 3 days if necessary. Your pet can have normal amounts of water following surgery. However, they may not be interested in drinking their typical amount of water for a few days due to the fluids given during surgery. If you are concerned about your pet's reduced water intake, you can add water to their food, or you can feed wet food. Your pet should be urinating regularly after surgery, but you may notice an increased frequency of urinations initially due to the fluids given. Some pets may have issues positioning themselves to urinate, and this can make it seem as though they are unable to urinate. If your pet is not urinated within 24 hours of coming home, please contact the clinic. If you are using a sling for your pet to assist with walking, make sure to let the sling drop when they are trying to urinate so that there is no pressure on their bladder. Your pet may not pass any stools for several days due to the anesthesia agents and eating less before and after the procedure. If they are not attempting to defecate, they may simply require more time. Severe constipation after surgery in some people is not common in veterinary patients. You can add 1 tablespoon of canned pumpkin per 10 pounds of body weight every 12 hours if you are concerned that they have not defecated. If your pet is straining to defecate and cannot produce stool, please contact us. For the first 48 hours after surgery, your pet's incision should be treated with a frozen gel compress we will supply you. This is done every 4 to 6 hours for a 15-minute period to reduce incision pain as well as swelling and bruising. Wrap the cold pack in a paper towel to prevent it from sticking to the incision. If your pet does not tolerate the icing or is trying to bite, please skip the treatment. There may be a dressing called a tegaderm still covering the incision when you get home. This dressing is designed to stay on the skin for 2 days after surgery. After the second morning that your pet is home, or if the dressing starts to peel off the skin, remove the dressing by applying a nab of rubbing alcohol to the adhesive edge. Be cautious when removing it, as it can be uncomfortable, like taking off a Band-Aid. It does not need to be reapplied if it comes off early. You will need to inspect your pet's incision at least once daily for any discharge, odor, or separations or gaps in the incision. Surgery wounds will likely show some bruising initially in the first 48 hours, but this should improve with time. If the bruising is expanding instead of resolving over 1 to 2 days, please contact us or email photos. After knee surgery, patients will often develop non-painful edema in the webbing of the ankle after surgery that may persist for up to 2 weeks after surgery. You can massage the webbing to help move the edema into the circulation. If your pet's incision has been closed with skin sutures or staples, they will need to be removed in 10 to 14 days. Inspect the sutures when you are evaluating the incision to confirm there are no missing sutures. Regardless of whether the incision has external sutures, it is critical that your pet not lick the incision. Bacteria from the mouth can move through the incision and reach the implants during this early healing phase. It is important not to bathe your pet until after the incision inspection appointment. We recommend that your pet wear an Elizabethan collar, also called an e-collar or cone collar, during the initial 2 weeks of recovery until the sutures are removed or the incision has healed. Licking at the incision can lead to significant and time-consuming complications, as well as additional costs. If you remove the cone for any reason, such as walks outside or when your pet is eating, they must be closely monitored to prevent licking. Keep in mind that many patients attempt licking within minutes of a cone being removed, or at night when you are sleeping. We do not recommend inflatable collars due to many patients' ability to get past these types of devices. If you would prefer a different type of cone, we recommend a comfy cone, which is available online and at many pet stores, or a bite knot collar, available from Amazon and other online vendors. After surgery, your pet's activity needs to be strictly controlled and limited for the initial 2 weeks, and then further controlled during the initial 2 months after surgery. Excessive early activity can result in fluid pockets, swelling, delayed healing, lameness, and a prolonged recovery. While in the house, your pet should be confined to a single room with no furniture on which they can jump, or a large crate or small pen. If you have slick floors, area rugs or carpet runners with backing should be placed in high-traffic areas. That is, make a path for your pet to walk outside for bathroom breaks. A sling may be helpful if they are having a difficult time walking. We will provide you a sling, but padded commercial slings can also be used. Pets should not have any free access to stairs, and playing with other dogs should not be allowed. For the first 4 weeks, your pet should be leash-walked outside for bathroom use only up to 3 to 4 times per day, with a sling until no longer needed. Patients must always be on a leash when outside. It is easy for them to be distracted by birds or small mammals, which might entice them to run off. Early rehabilitation exercises are helpful in returning your pet to full function. During the first week, swelling may cause more discomfort when performing the exercises. However, not performing the exercises can make the edema and swelling persist longer, which can prolong recovery. A list of various exercises you can perform is available by scanning the QR code to the right. This code will also be in your discharge instructions. The instructions are intended to be a guide, and completion of all exercises on the list is not necessary. Typically, there are 2 scheduled appointments after the TPLO procedure: incision inspection and final radiographs. Suture removal, or incision inspection, is performed at 10 to 14 days after surgery. There will be no charge for this appointment when performed at VSC, but you can also contact your primary veterinarian to have the sutures removed. If no sutures were placed, we will inspect the incision for healing. You can send in pictures of the incision in a well-lit area if you prefer not to bring your pet in for the appointment. Final X-rays are typically performed at 8 to 10 weeks after surgery to ensure your pet has healed appropriately and can be cleared for full activity. Your pet may need to be sedated for this appointment, so we recommend they skip breakfast. This appointment is not included in the surgery fees. If you have questions or concerns during the recovery process, you can get answers on our frequently asked questions page, via text or email, or by phone, depending on the time of day. You can use these links to reach out to our team to ensure your pet has the smoothest recovery possible. We look forward to seeing you at your appointment.